Philadelphia sports writers. I spoke. I can't remember who I spoke to, but I asked, well, how did they cover a player? Did you have a notebook, or what did you do when somebody? Because I was look at the daily papers and look at the quotes from the different columns and articles, and they were all slightly different or things like that. So how do I know which one is right? And this one writer said, look, everybody did it differently. Some people had tape recorders. Some people took notes. Sandy Grady, who was a great columnist in the 60s and 70s, I think somebody, maybe Bill Conlon, said, "Oh, Sandy Grady was from the French Impressionistic school of sports writing. He wouldn't take any notes, and then he would recreate the quotes later, and nobody ever challenged him because what he would write was invariably better than anything anybody would have said." Which I found interesting in that the sports writers all approached their jobs differently. They all did it differently. Some sports writers were buddy-buddy with the players. Others were made it a point not to go out with them after the games. But nobody criticized the other writers for doing it differently. They realized they could do it differently. But when it came to covering Allen, well, if Allen did things differently, that was a problem, which just seems kind of odd.
How did the Philadelphia Tribune cover him, the black paper in Philadelphia?
They were very interesting to read because now they didn't cover. They were not a daily paper, so they didn't have the coverage, the daily coverage. Obviously, that was in the Daily News, Inquirer, and the Bulletin. But they had a columnist, Claude Harrison, who wrote a lot about baseball. And when he wrote about baseball, he was really writing about other things. He was really writing about civil rights or equality through baseball, which is much different than with the story you get in the Inquirer and the Daily News. And he would often write about Allen, and he would take a different approach to Allen and talk about, Allen. One thing that Allen always talked about was, I want to be treated, fairly, and then the response to that was, Allen's asking for a different set of rules. He wants to be treated by his own set of rules, and Claude Harrison said, okay, well, let's examine that. Allen says he wants a different set of rules, but wasn't there always a different set of rules for blacks for decades? And so why don't we talk about that? Why are we only talking about Dick Allen wanting a different set of rules when in spring training, white players stayed in the Fort Harrison Hotel and the black players were pretty much left to fend on their own in rooming houses? Nobody talked about those things. And you didn't hear that in the daily press, but you read it in the Tribune. And the Tribune was very activist in nature, and you really got a different perspective on Allen and the era and Gene Mauch and Bob Skinner. And it was really interesting to read because a lot of the perspectives that I read in there were things I had read nowhere else, and which it only made sense because you're talking not just about the game. We're talking about something bigger.
Did you try to interview him for this book?
Yes, I did. I was unable to interview him. He's still around, but I was unable to reach him. I was, however, able to speak to people who worked in the building, in the Tribune building, who told me their own stories of going to games in the early mid '60s and their own recollections of going to Connie Mack Stadium to see Allen and why they went. One of the things I cover in the book in the early part is how the Phillies had just a terrible relationship with African Americans, and how Bob Carpenter showed no interest in not no interest in signing black players. He had no interest in cultivating black fans. He was blind, deaf, and dumb when it came to those things. And so it was the Phillies did not have to say they didn't have a good reputation among black fans is an understatement. But when Allen showed up, I think a lot of African-American fans said, well, now, okay, here's someone we can root for. And when he was being, pilloried by the white fans or the press, a lot of black fans showed up to support him because they're looking at this from perhaps a different perspective. And so I was able to get some of those stories, and they were really interesting as well, and I included those also because there's more. The whole story is, I guess the one theme is that there's more than one perspective when we talk about Dick Allen.
We're just about out of time. You teach at Villanova?
Yes.
What do you teach?
Legal writing. Generally, I do a little sports law here and there, but generally mostly legal writing.
How long have you been a Phillies fan?
Since 1972.
Do you remember Connie Mack Stadium?
I drove by Connie Mack Stadium. I mean, I remember the vet. I don't really remember. I never went to a game in Connie Mack Stadium, but a product of the vet.
Is this your first book?
No, this is my fourth. I wrote one about almost a decade ago about the Black Friday game in 1977. And I actually wrote a little bit about, actually that book was more kind of a cultural or a social, a study of the social relationship between the city and the Phillies and the A's. And in there I kind of talk about why this Philadelphia fans really don't like the Phillies historically. And I talked a little bit about Allen in there, but not too much.
Well, we're out of time. This is the book we've been talking about, God Almighty Himself, The Life and Legacy of Dick Allen. Mitchell Nathanson, thank you very much.
Thanks for having me.
Take your favorite show with you wherever you go. PA Books podcasts are available for free by searching PA Books on PCN. This week on PA Books.
Charleston was what would be called today a five-tool player. He could hit. He was a great sort of batting average sort of player. He could hit for power, hit a lot of home runs and very far home runs. He was a great fielder in center field. He could run and he could throw. He did not have a weakness. His only weakness was his temper.
Jeremy Beer, author of Oscar Charleston, Sunday at 7 p.m.
Tired of unbalanced views and networks pushing their own angles? PCN brings it to you straight. We don't edit what was said to fit a point of view. We bring you the entire event. No slant, no editing, the whole story. A complete view without the angle. Watch PCN on cable and on the PCN app. Stream politics and policy on your favorite device for free.
Go ahead, Secretary Levine.
Well, good afternoon. Thank you for joining me today. I'd like to give you an update on COVID-19 in Pennsylvania. At this time, 6,346 people are hospitalized due to COVID-19 in Pennsylvania as of 7 a.m. That is double the peak that we saw in the spring. 1,238 of those patients are in the intensive care unit, and 745 of those patients are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased 5,200 since the end of September. And we continue to hear of additional hospitals across the state that have few ICU beds left, or in some cases, no ICU beds left. Our hospitals and our health systems in Pennsylvania are significantly challenged due to COVID-19. Today, we are reporting 9,966 new cases, which brings the total number of COVID-19 cases in Pennsylvania to 529,335. Tragically, 224 new deaths were reported today, for a total now of 13,392 deaths attributed to COVID-19 since the start of the pandemic. As you know, however, vaccine deliveries have begun in Pennsylvania and nationwide. Now, this is great news, but the process has just started. 16 hospitals have successfully received a vaccine and have begun vaccinating healthcare workers. Right now, 1,205 doses of vaccine have been administered to healthcare workers as of noon today. And so far, we have not had any reports of adverse side effects. The remainder of this week's allotment of 97,500 doses is on its way to the 71 remaining hospitals. So in the first 3.5 days of this effort, things are moving smoothly in Pennsylvania. Vaccine delivery has not been delayed because of the snow so far, and hospitals are working as quickly as possible to administer the vaccine. Now, this is really an enormous undertaking, and I want to thank our hospital partners for all of these efforts, especially in the face of also taking care of the surge of patients that they are seeing due to COVID-19. Now, I do want to underscore to everyone in Pennsylvania that this is going to take time to get to everyone, to make sure that everyone who wants the vaccine can get it, including those in the priority categories set forth by the CDC. The administration of the vaccine itself takes time. Everyone is observed after receiving the vaccine for any side effects. And again, in Pennsylvania, we have not seen any. We are also, and this is a critical point, dependent upon how much vaccine is actually delivered to us by Operation Warp Speed. That depends on how quickly the vaccine can be manufactured by the pharmaceutical companies. While we are at the start of the road out of this pandemic, our light at the end of the tunnel, the path is long and it will take time. In the meantime, we absolutely cannot afford to overwhelm our hospitals any further. The mitigation efforts that we have in place are absolutely needed to get through this very challenging time. Now, and the governor has said this many times, we all want this to be over. We all want to celebrate the holidays together and to be with the people that we love. But this year, we simply can't. We have to keep each other safe and prevent an even bigger wave of hospitalizations than the one we are seeing now. So until everyone can get vaccinated, which again is going to take time, we need everybody to answer the call and wear a mask. We need them to answer the call and stay home and avoid large and small gatherings. We need people to answer the call and social distance. We need them to download the COVID Alert PA app. And of course, we need them to wash their hands. We need people to literally answer the call. If our case investigators or contact tracers call, to give them important information that could save lives. And as always, please continue to stay calm, stay alert, and stay safe. And I'm very pleased to answer questions.
Thank you, Secretary. Our first question is from Jamie Martinez from Spotlight, PA. Go ahead, Jamie.
Hi, Dr. Levine. Thanks again for taking questions. Can you talk a little bit about any concerns you might have about vaccine distribution and cooperation with the federal government? You've given us a lot of detail about how the state is going to handle any unforeseen circumstances like weather, distribution. Can you just give us some more insight on what the communication and relationship is like with the federal government and troubleshooting that might occur if unforeseen circumstances come up?
Sure. Well, we have a very close association with the CDC and Operation Warp Speed. Our team speaks with them daily about all aspects of the transportation and then the distribution of the vaccine. They keep us up to date on any changes. And so that relationship is very strong, and we've had, very good communication with the federal government. I see no problems with that. Do you have a follow-up? Okay, please proceed.
Jimmy, any follow-up?
No, I'm set. Thank you.
Thank you.
Next up is Aaron McCarthy from the Philadelphia Inquirer. Go ahead, Aaron.
Hi, Dr. Levine. Thanks so much again for taking the time to chat with us today. We're now 3 weeks from Thanksgiving, and you mentioned the possibility of another surge after Christmas and these upcoming holidays. Would you say we are at this point past the post-Thanksgiving surge, or are we still seeing the impact of those gatherings and travel in the numbers that are being reported?
Well, I think we're still seeing the impact of that. I mean, we reported almost 10,000 new cases today. It takes time for people, the incubation period is 2 weeks, and then sometimes people develop symptoms. It takes a while to get tested, et cetera. So I think we're still seeing the impact in terms of Thanksgiving. I think it is critically important as we approach Christmas and New Year's that the people really listen to the messages that we're putting out there. I think it's critical that people stay home. I think that it's critical that people avoid large gatherings, but also small gatherings. I know that people want to see their friends and relatives on Christmas and New Year's, but now is the time really to stay within your household, to have social interactions on platforms like this, and to really protect themselves, their family, and the community from this virus.
And I don't know if you've had a chance to speak with Governor Wolf since we last spoke a couple days ago, but have you and he had a chance to discuss when you may get vaccinated, and do you plan to do so publicly? And would you recommend that he do so even after testing positive for the virus as recently as last week?
Well, we are speaking about that. I don't have any new information for you, however.
Next up is Scott Beveridge. Scott, go ahead and unmute yourself.
Yes, Dr. Levine, thanks for taking my question. There's a growing number of restaurants in the Pittsburgh area, southwestern Pennsylvania, that are defying the order for no indoor dining, and mostly it involves claims about there isn't any science or data to back up that their businesses are any more or less unsafe than Walmart or Target. What do you have to say to these people?
Well, first, I really think that they're really hurting themselves. They're putting themselves at risk. I think they're putting their staff at risk and their patrons and their customers at risk by having restaurants, indoor dining and restaurants open at this time. And I think it can impact the entire community. There is robust evidence for the last 6 months or more about the spread of this virus for indoor dining in restaurants. And so there are many articles that have been published both by the CDC as well as other academic articles. In the summer, we talked about evidence, particularly actually evidence that Dr. Bogan had collected in Allegheny County about the impact of indoor dining in restaurants. And so, I think that it's counterproductive to the public health of their community, of their county, and our state to do that.
Thank you.
Next up is Tyler Pratt. Tyler, go ahead and unmute yourself.
Hi, Dr. Levine. I have a two-part with a follow-up. With the vaccine on everyone's mind right now and healthcare workers getting it, can we look into the future and sort of talk about plans that Pennsylvania and the health department has for unrolling this for the general public? Do you plan to work with CVS and our pharmacies like y'all did with testing to unroll it for the general public?
Sure. vaccine plan is on our website. And as we've been discussing for weeks now, there are 3 phases, phase 1, 2, and 3. And we're in the phase 1A now, which is healthcare workers defined very broadly. And then starting on the 28th of December, distribution through CVS and Walgreens to nursing homes and then other long-term care facilities. Phase 1B are frontline workers, as well as those with particular risks, health risks, and et cetera, to COVID-19. Phase 2 will be vulnerable communities and other priority populations. And then phase 3 is the general public. I can't tell you exactly when that's going to happen. It really very much depends upon the production and manufacturing capabilities of the pharmaceutical companies, and then how much vaccine we get. What federal authorities have been saying, Dr. Fauci and others, is that we might anticipate the general public being vaccinated perhaps late spring. I guess it could be in the summer. That would be probably the best educated guess that I could give you.
I'll use my follow-up to dig in just a little bit more on that. I'm using more specifically, just trying to figure out how would the general public go about getting the vaccine? Could you talk about that? Go to a pharmacy? Do they have to go to a healthcare provider? Can you talk a little bit more about that process for the general public down the line that may not be on the website?
Sure, absolutely. So we plan to use all of those different methods to vaccinate the general public. Now, a lot will depend which vaccines we have. Again, the Pfizer vaccine has to be kept at minus 80 degrees centigrade, which is very, very cold, and only certain hospitals and certain pharmaceutical pharmacy companies have that type of capacity. But the Moderna vaccine is much more flexible, and then there are 2 more vaccines in the early pipeline, the AstraZeneca and Johnson & Johnson vaccines. So we plan to contract with pharmacies, as you said, for distribution. We'll be working with healthcare providers, federally qualified health centers. We'll be having vaccination clinics. And so we really plan a widespread distribution campaign to be able to administer the vaccines to the general public.
Next up is Mike Gorsinger from CBS 21. Go ahead, Mike.
Hi, Dr. Levine. Thanks for taking the time. Wanted to first ask, how exactly is it being determined which hospitals are receiving the first dosages of vaccine, and then kind of how it goes down the line over these first couple of days where the vaccine is available?
Sure. There are 87 hospitals that are receiving the vaccine this week. Those are hospitals that have 2 requirements. So you have to be able to, because it's the Pfizer vaccine, you have to be able to have storage requirements of minus 80 degrees centigrade. So ultra cold storage requirements. And it comes in trays with 975 doses. So you have to be able to do a lot of vaccinations very, very efficiently. And then the Pfizer vaccine next week, depending upon how much we get, will go out to hospitals as well that have those requirements. And then we're hopeful that the Moderna vaccine will be approved, that's today, with an EUA, and then go before the full FDA and the CDC Advisory Committee. And so we are hopeful that we'll be able to also distribute the Moderna vaccine next week. Now, we don't know exactly how much we're going to get, but it's much easier to distribute and to store because it can be kept essentially in a freezer. And so there are hospitals, particularly in rural areas, that could not get the Pfizer vaccine, but will absolutely be able to get and then distribute and administer the Moderna vaccine.
Okay, any follow-up? All right, thank you. Next up is Sam Zern. Sam, go ahead and unmute yourself.
Hi, Dr. Levine. Thank you for taking questions. I'm curious at what point or at what phase people who are incarcerated will be getting the vaccine.
So individuals in correctional institutions as well as staff are in phase 1B. And that's available on our website.
Next up is Jim Millward from KYW. Go ahead, Jim.
Hi. Follow-ups on two previous questions. The first one, following up on Aaron's question about the governor testing positive and then getting a vaccine. What is the recommendation to people who have tested positive but are in line to get a vaccine?
The recommendation is to get the vaccine. So we don't know how long immunity will last. And it appears that the robustness of immunity might depend upon how serious the case was. That if your case was if you had more symptoms and a more serious case, you might have a more vigorous immune response. If you had no symptoms, that you might have a much less vigorous immune response, although those studies are still continuing. So the recommendation from the CDC is it doesn't make any difference whether you've had it or not. You still get the vaccine.
And I hate to belabor the point, but I'm going to follow up on Scott's question. You point to summer studies from the summer regarding restaurants, but there doesn't seem to be any direct evidence of widespread transmission from restaurants and gyms and in contact tracing. And there doesn't seem to be any data from restaurants operating under the occupancy restrictions that they've been under for several months. If restaurants are doing what we're saying they are as far as spread, wouldn't there be more obvious data on transmission from them recently being while those restrictions are in place?
Sure. There is national data and national articles about that. So I've been saying for a while now, when you have 9, 10, 11,000 new cases a day, our ability to do contact tracing and case investigation changes. So no matter how many people you have, there's no way that we can reach 10,000 people a day. So our ability to get very specific information about location, such as eating in a restaurant or being in a business, is for the most part not possible now. Whether it's in Pennsylvania or any state or any large city, such as, for instance, Philadelphia. And so really our case investigations and contact tracing now are prioritized to congregate care settings, so to nursing homes and other long-term care facilities, to corrections that has been mentioned already today, to schools, and prioritized to seniors. So we're not able to get that type of data now because we're in our surge. But the data that we have, the data that's available throughout the country and the data that we've had over the last 6 months are valid. And it has been very clearly shown that restaurants serve as a significant source of spread, and thus the mitigation efforts that we put into place.
Next up is Barbara Barr. Barbara, go ahead.
Hi, Dr. Levine. Good to see you again. Let me ask you just to follow up regarding that last stage with community. A lot of seniors, I think, have had questions and are wondering whether they should contact their family doctor to set up an appointment to get the vaccine. Seniors in particular, what advice would you give them at this point?
I think that will be very important in the future. Right now, seniors who are not in congregate care settings will not be able to get the vaccine. Seniors 65 and older are in 1B, not in 1A. The seniors that will be getting the vaccine starting on the 28th are seniors in nursing homes and then other long-term care facilities. That's going to be accomplished by the pharmacy partnership that we have through the federal government with Walgreens and CVS. So we have chosen the Pfizer product for that mission, and Pfizer product will be dedicated to Pennsylvania to go to distribution sites for Walgreens and CVS, and from there, working with subsidiaries, they will be going to the long-term care facilities, to the nursing homes, to immunize the staff and the patients. Now, as we complete 1A and we're headed towards 1B, then we will be working out all those arrangements for vulnerable seniors and others with vulnerable conditions, frontline workers, et cetera, to be able to get the vaccine in phase 1B.
Got it. And if I may, just on a little bit of a different issue, there are reports coming out that there could be extra doses in the Pfizer vaccine. Any clarification as to whether that's okay to use or should be discarded?
Sure. So this is new information over the last couple of days, is that it's supposed to be have 5 doses in the vial for the Pfizer vaccine. But it appears that that there is more than 5 doses, that there's often enough for 6 doses and potentially even more. The FDA just came out with a recommendation, is that the healthcare systems, hospitals administering the vaccine can use that extra vaccine. What they can't do is take vaccine from different vials and put it together. But if they have enough for another shot in that vial, the recommendation from the FDA is to use it. That is very good information, because then we can immunize more people.
Next up is Paul Go, Pittsburgh Business Times. Go ahead, Paul.
Hi, Dr. Levine. Thank you very much for taking the time. I wanted to talk to you a little bit about the timeline for deliveries. You mentioned that I think 16 hospitals in Pennsylvania have received the vaccine so far. And initially, we'd heard that it was through to Thursday that the initial week delivery would be. Is that changed at all, or all the 70 plus that are hospitals in Pennsylvania, are they going to get their vaccine today?
It's not today, by tomorrow.
Okay, because that's that's obviously a lot of hospitals to do, depending, and it's a big state. And then is that going to is there a reason for that that it took so long for the bulk of them to happen?
That was the distribution schedule from Operation Warp Speed. Again, our mission starts when the vaccine is delivered to, right now, the hospitals. And then, we work with them, and they're working on that administration of the vaccine. Operation Warp Speed has complete control with the pharmaceutical companies, and then for Moderna with transportation companies in terms of getting it to where we tell them to get it to. Right now, hospitals. So that was their distribution schedule.
Next up is John Moser. John, go ahead. One more call for John Moser. Okay, moving on to Jeff Cole. Okay. Looks like Jeff Cole is not on. Next up is Shay Singley. Shay, go ahead and unmute yourself. No question from Shay. Okay, moving on, Nicole Brambila. Nicole, go ahead and unmute yourself.
Thank you, Secretary, for taking my question. I appreciate your time and understanding that Operation Warp Speed is dictating much of our timetable. Do you have a rough estimate about how soon our residents in nursing homes might be inoculated with the vaccine?
Sure. That part of 1A will start on the 28th, so a week from Monday.
And any idea about, which sections of? Thank you for the follow-up. Which sections of the state might be receiving that first, and about how many? Again, recognizing that it's a moving target.
So we don't. Actually, they're going to be delivering the vaccine to CVS and Walgreens distribution centers, and then CVS and Walgreens are going to be working to bring the vaccine to the nursing homes to immunize the staff and the patients. So it's actually not our system that decides that; it is their system. Now we're hopeful that we're going to have the Moderna product for hospitals, and then half of our Pfizer product will be for that mission for the nursing homes. But we really don't know how much we're going to get. We get these estimates and then they change them a couple of days later. It really depends upon the production manufacturing schedule.
Next up is Sam Ruin. Sam, go ahead and unmute yourself.
Here we go. Hello. I just wanted to follow up with a few questions just about distribution, a little bit about the logistics. So you said that 71 more hospitals were receiving the shipments today. Did you mean today, or is that the rest of this week? And just kind of for next doses, is that something that's going to be happening? I know at some point they talked about, getting weekly allotments. So are we going to see another batch of the vaccine coming on Monday, like for the hospitals that haven't gotten it yet?
So we anticipate that the remaining hospitals will get their allotment today. If it's not today, it'll certainly be tomorrow morning. We do anticipate weekly distribution of the vaccines. Again, Pfizer, and then hopefully Moderna if it receives its FDA EUA. But we don't know exactly how much we're going to get. We hope to find that out, as the week progresses. But all that is determined by Operation Warp Speed in the CDC.
And then, so does that mean, next week you guys will be getting new doses? Because is that going to at all come into play when it comes to how is it going to be made sure that kind of these rural hospitals are prioritized and kind of when they get the vaccine?
So we know we'll be getting doses of Pfizer. We don't know how much. And we anticipate that we'll be getting doses of Moderna, but that depends upon what the FDA does over the next day or so. But let's assume that it does receive its EUA. Then we do absolutely anticipate transportation and distribution of the Moderna vaccine. It's the Moderna vaccine with the less stringent refrigeration requirements that will be going to rural hospitals for the administration to healthcare workers there.
Next up is Bill O'Boyle from the Times Leader. Go ahead, Bill.
Thank you. Dr. Levine, I'm in Luzerne County, and as you probably know, we are seeing a marked increase in cases the last few days, even over the last week or so. Today, we had 534, which is an all-time high for us by far. We had 480 some yesterday. Two questions. One, can you identify for us where the predominance of these cases are coming from? Are these just from community spread, or is there institutional? We are hearing there are high cases in our correctional facilities. We have SCI Dallas here. I have reached out to them. I've not gotten a response so far for them. Or can you just tell us why these numbers are getting so scaringly high in Luzerne County? And then I have a follow-up. Thank you.
Sure. I don't have specific information at my fingertips on Luzerne County, but I would say it's probably all of the above. We know we see cases in correctional institutions. We know that we see cases in nursing homes and other long-term care living facilities. The amount of cases that we see in those congregate settings is directly proportional to the amount of cases and community spread that we see in the county. So we know that there is widespread community transmission of COVID-19 really essentially everywhere in Pennsylvania, which is why we need people to answer the call and to work and stand united to stop the spread. Wear a mask, social distance, avoid large and small gatherings, really stay at home unless you have to go out. And when you're seeing the type of numbers you're seeing, makes it even more important.
And that leads me to my follow-up, Doctor. How frustrating, and I've wanted to ask you this question for a long time, how frustrating is it for you and your department and the governor to see that so many people just apparently are so reluctant to follow the recommendations to help push back this virus and are refusing to wear the masks, to refuse to stay at home or not congregate and violate all the recommendations just about that you have put out there? How frustrating is that for you guys, and what can you do about it?
Well, I wouldn't say frustrating is the right word. I would say it's motivating, meaning I use people's questions and maybe not following the guidance as further motivation to continue to try to get the message out and to say it in different ways in different settings so that people can people can understand. So I've been in addition to being a practicing physician at Penn State Hershey, I've been an educator. I'm a professor at pediatrics and psychiatry at Penn State College of Medicine, and so I've been a teacher. And so what I'm trying to do is to teach people about about public health, about the seriousness of this contagious and dangerous virus, and how they can protect themselves, their family, their community, and our Commonwealth. And I will stay laser focused on that mission.
Our last question today is Patrick Abdallah. Patrick, go ahead.
Thank you, Dr. Levine, for taking my question. I had a kind of a two-part question for you. The first is there going to be a place on the state's website that's going to show us how many people have been vaccinated up to a certain point? And the second question is
one at a time, if you could, because I end up forgetting this at the beginning. So yes, we're going to have a dashboard on our website with that information. That will be forthcoming.
Thank you. And my follow-up is, what's the process for ensuring people get their second dose of their vaccination?
So critical process. We have a whole system arranged for people to, in terms of reminders, to make sure that that they get their second dose. It's also really important that that whoever's giving the first dose, the hospitals, et cetera, are part of that process in terms of reminders, and to make sure that people come back for the second dose. The second dose for Pfizer is after 3 weeks. The second dose for the Moderna is 4 weeks later. In addition, Operation Warp Speed automatically puts aside, and they store, we don't store it, they store exactly how many vaccines will be necessary for that second dose. So this week, we're getting 97,500 doses that we're administering of Pfizer. Operation Warp Speed is currently storing 97,500 doses, which then we know that they will ship at the right time for us to be able to give the second dose. The same will be for the Moderna, although it's 4 weeks later. And so, and then if people don't show up, then we have a whole system to recall them. So it's going to be critically important. It's complex, but it's going to be critically important people get those second shots, which will offer the very best protection. Any further questions? Any further questions? April, are you still on?
I believe that's all the questions for today. We will record this briefing and we will post it at the pacast.com. For any members of the media with additional questions, please feel free to contact our press office. Thank you.
Thank you all very much.
Travel with PCN across the state as we capture Pennsylvania's rich history and diverse culture. Journey back in time as we tour the state's many battlefields, listen to the stories of veterans, and hear insights from authors of the past. Explore